Major depressive disorder affects 1/10 of the world's population and is the leading cause of disability worldwide. Unfortunately, one of the most commonly employed treatments, antidepressant medication, doesn't work for everyone. So, if there were a natural supplement that, when added to an antidepressant, could help improve the likelihood of response, what would you do about it? Here to talk about a newly released study on this topic is psychiatrist Dr. Joshua Weiner. Thank you so much for coming in.
My pleasure.
So before we delve into this study, we're just a little curious about the rates of depression because it seems like they're on the rise lately.
They are. So the latest studies seem to suggest that the numbers of people who are reporting depression in this country has gone up by almost 30% in the last decade. We don't really know why that is. Have some theories. Maybe it has to do with social media, lifestyle issues, people not getting enough sleep, processed food, etc. But it is true, these numbers are on the rise.
Wow. So tell us about this study and the study findings.
So basically, the key point with this study is because we know that antidepressants don't work for everybody, they work for a lot of people, but there's this definite subset of people who don't respond that well. Anything we can do to try to help the response rate is really important. And what this study found is that if you add omega-3 fatty acid supplements as part of the treatment regimen to an antidepressant, you improve the likelihood of response. So they did not find that using these omega-3 fatty acids necessarily on their own for the majority of the people had an antidepressant effect, but the combination of the omega-3s plus the medication work better than for people who just took the medication alone.
Wow, very interesting. So what is it about the omega-3 fatty acids that maybe makes them helpful with treating depression?
So what we think is that it has to do with two things. Number one is omega-3 fatty acids are involved in sort of the outer layer of the brain cell called the neuron, and it just helps that neuron fire and function more effectively. The other thing is that omega-3 fatty acids seem to have an anti-inflammatory property, and there's more and more data coming out over the years suggesting that for at least a decent subset of people with depression, the underlying issue to some degree is inflammation. So anything that you can do to lower the levels of inflammation in their body is going to improve the likelihood of response.
Okay, and real quickly, what are key things that people need to know before they take these omega fatty acids?
So the big takeaway point here is you want to focus on EPA. Just remember, Environmental Protection Agency. It stands for eicosapentaenoic acid. You want to take roughly 1 gram or 1,000 milligrams a day of EPA. You want to find a product with at least twice as much EPA as DHA. The two products that I recommend to my patients, one is called Nordic Naturals EPA Extra, and the other is called Omega Bright. Those are two products. You can get them on Amazon. That's what I recommend to my patients.
All right, Dr. Weiner, great information. Thank you so much.
My pleasure.